Hi, welcome back to a Brown Woman Health Live. It's been a while, so we have two special guests, and we're going to be talking about very relevant and important topics. So I will be waiting for our guests to join our live, but in the meantime, feel free to send us any questions that you have for our guests. We have a lot that we have planned for today, and we're excited to have you tune into our live. Okay, so let me. Okay, I just accepted you guys to join the live, and it worked. Okay, hello.
Hi.
All right, so and then
Wait,
go into the book.
it's cutting out. Um, for for Brown Woman Health, it's cutting out, I think.
Okay,
Wait, now I can hear you. It's just like going like staticky a little.
okay. Let me. Yeah, I'm not too sure.
Okay.
Um, but let's start off with you guys can introduce yourselves, and then maybe we
Okay.
can book, and my live will be better. All right.
You you can go first if you want.
We are so week. I'm part of Brown Women Health, and I'm super excited for this live. I am very passionate about mental health as well as wellness. So I think this is a really important discussion to have. I think we're going to go into some really relevant topics, um, like climate, if that's the right way to phrase that. And I think that's really important too. So I'm really excited for that. Yeah. Iman, do you want to stop? Or do you want to
I'm
stop?
gonna join again. I think mine is like messed up.
You're
So
cutting
go ahead.
out on me too.
No
Oh,
worries.
okay.
Uh, I'm cutting out for
For many.
everyone, I think. Okay. I'll figure that out. I think because it's rainy here. But yeah, all right. Um, I can get off Wi-Fi. Um, okay. Um, do you want to introduce yourself, Mrinal?
Hi, everyone. I am an author of two books about South Asian mental health. Not a clinician. I just want to put that out there. I know Amik and Brown Women Health because I was a guest when I published book number one in 2021, and I have collaborated with them many times ever since when it came to coming up with ideas for and producing, helping to produce different series about health issues that are relevant in our community.
And then, Iman, do you want to introduce yourself too?
Sure. I am Iman. I am a queer Bangladeshi disabled advocate who talks a lot about chronic illness, disability, and intersections between the two. So I'm so happy to be here. Thank you so much.
Well, thank you for being on this live today. So, I think what we wanted to start off is Mrinal's book, and then from there have a discussion um, on the book, but also so. Mrinal, do you want to start off with talking about your book maybe a little bit, and then you could.
Okay, you cut out again, but did you
Yeah,
say
I
that I should
can't
talk about my
hear.
book?
Yes.
Okay.
Okay, so I'm the author of two books about I published in August of 2021. It is a collection of 16 true stories, written all in third person, featuring interviewers between myself and the person, each person. And I basically write their stories in third person, regarding their journeys, regarding how they went about fighting stigma and and whatever else in our culture.
And this was your second book, right?
Yeah.
So, what are maybe some of the differences that you've seen within your first and second book?
So for book number 1 is a collection of 11 stories. This is about 16 stories. And for book number 2, I made it a point to have more diverse identities within the diaspora being represented in it. So book number 1 only had 1 or 2 males tell their stories, because no matter where I looked and how hard I tried, I could not find a lot of men to tell their stories. The second book is almost right even. Definitely met more males that were willing to talk this time around, thankfully. There was no LGBT representation in book number 1, but there is in book number 2. My cover designer, Ali Patel, shout out to her, the founder of the Queer South Asian Women's Network, is the illustrator of my cover. And she was the one who pointed out that the first book did not have LGBTQ representation. And I'm glad she did. And I'm glad that the second time around, I was able to find people from the community willing to tell their stories. This book too, I think, talks about more variety of conditions such as chronic illness and disability, neurodivergence, and things like childhood trauma, domestic abuse, and other various experiences that weren't found the first time around.
All right. Well, thank you for sharing that. Do you want to talk a little bit about the excerpt of the book that you're about to read, or like the part of the book that you're about to read?
Well, since today's talk is about the intersection of disability in relation to chronic illness and mental health, I found a story that's relevant to just that. This is the story of Anna Sampson, who is from Canada, and she talks about her life living with chronic physical illnesses and how that relates to her mental health as well, and the unique issues she faces in the South Asian community when it comes to attempting to live her best life with these illnesses.
All right. I think we have interviewed her on our podcast, so I think
Yes.
this is also something that's and Ivana, do you know Anna?
Yeah.
Okay,
Yeah. I just typed it in for people.
Okay, awesome. Yeah,
Yeah.
so I think this is going to be a really impactful reading, especially because we know the person. But I think something
Yeah.
about the way that Mrinal writes, I know, especially for the first book too, I'm not really a reader, and I read the whole thing in I think one sitting. So you really get into launches of the stories or the people you're writing about. So I'm excited. All right. So feel free to start the book reading.
Okay, so without further ado, the name of the story is called Upward Mobility. Okay, so we're going to read a sample of part of it that talks about the symptomatic qualities of fibromyalgia. Just a year after a depression diagnosis in 2013, chronic bodily pains began. Anna simply assumed that the pains would go away on their own. On her 17th birthday, a friend visited that told Anna that she was feeling sick. I didn't know I had a compromised immune system at the time. She had strep and I got it, and I thought it would go away in a few weeks, but then I felt like I was in a flare-up that would not go. After almost 2 years of declining invites from cousins to hang out due to pain, Anna saw a rheumatologist for an MRI scan. She was then diagnosed with ankylosing spondylitis and fibromyalgia, 2 chronic illnesses. Ankylosing spondylitis causes spinal and large joint inflammation, and fibromyalgia causes musculoskeletal pain combined by sleep, mood, memory, and fatigue issues. With fibromyalgia, if I'm having an anxiety attack, I feel as though I'm at the peak of having a flu, Anna said. It's like you cannot do anything because you feel so sick, and it's all you can focus on and don't see an end in sight, she said. With her depression, Anna was told she was too far from God. With her grades, Anna was told to work harder. With the pain, much to her surprise, the family was willing to help. When I tell people I can't hang out due to physical pain, they get it. But if I say my mental health isn't the issue, they take it personally and would sometimes accuse me of lying. A typical flare-up for Anna includes dull pains in the back, hips, and knees, and a pins and needles-like throb in the hands and feet. Sometimes Anna couldn't arise from bed or bathe without help. The primary doctor theorized that the fibromyalgia may have stemmed from Anna's childhood turmoil, as several studies have suggested a trauma link when it comes to the origin of the disease. Though initially helpful, Anna's parents questioned the legitimacy of her conditions once they realized the pain was not ending. They would imply the belief that Anna was exaggerating the pain and would feel frustrated if their suggestions for remedies were unhelpful. And I'll leave it at that.
All right, thank you for sharing that excerpt. I will go hopefully back and get my copy of the book and finish that chapter. But yeah, so when you were writing that story, um, were there any sort of like thoughts that you had when you were getting the story about Anna, or like things that you found different about her story compared to like other stories that you've written?
I would say that this was a first or one of the first stories that I wrote that had to do with a chronic illness, and particularly a musculoskeletal type of issue.
Mm-hmm.
And however, and while I've seen and experienced stories where mental health and physical health intertwine in some way. This was, like I said, the first straight up chronic illness one that I wrote. And it was rather intriguing how Anna would describe that the pain and her emotions were so strongly intertwined. And it made me, I've met people with diseases like fibromyalgia before, and I just cannot imagine how hard it is to live your life that way. And I fear that I would be on eggshells all the time if I had that type of a diagnosis. And I think to top it off, there's also the element of the cultural element of being accused of not trying hard enough, or having our physical health respected more than our mental health by our elders, and having to go through the headache of trying to educate them that I may live with this disease for the rest of my life, and that's perfectly okay with me. You can give up on trying to fix me and instead support me on, making it so that the world accepts me and that I can access the supports that can help me to live this way too.
Mm-hmm. Yeah. Wow, that was you just said so much, and I think that those are all really important points. Like, the acceptance part. Then you do on the themes of culture and how that plays a role. And then I'm trying to remember what your very first point was, but that was also something that I was gonna ask a follow-up question on. So I have to just remember what
About
that was.
the mental and physical health link, and I think I was saying that she's the first person with the musculoskeletal and chronic illness that talked to me about how it intertwines with mental health. But in the past, I have met people that in general would say that physical and mental health are linked in some
Mm-hmm.
way.
Yeah, no, I think they like definitely have this connection, and I think it's so interesting that you've seen it now from like both ends of it, how mental health ties to physical health, and now just like the complete circle of it. Um, but yeah, Iman, do you have any thoughts based off of like the story that we just heard, or
Yeah.
anything you want to try?
So I actually have fibromyalgia.
Oh,
Um, so I relate pretty much to everything that Anna said, and I also have talked to Anna quite a bit and love what she shares, because I have noticed that a lot of people don't believe it's a real thing, doctors included, and it's really hard because it will be invalidated and like almost so by rheumatologists specifically. So something in the chronic illness community is people just like have the worst luck with rheumatologists. They never like believe in a lot of these things, or they do and then they can't do anything about it. Or you're borderline, so they don't know like what to do with you. So you just kind of sit there and wait until it gets worse to the point of like help. Fibromyalgia is one of the interesting ones where like a lot of doctors don't believe in it because of the fact that there isn't much they know. There's a lot of symptoms of it that I remember learning about like 7 years ago when I first was kind of talked to about it. And yeah, the nerve pain is a really big one. Sometimes when I take a shower, just like the water hitting my skin is like needles. And like I just didn't know what that was, but I forget there's a term for it. And it's really connected to specifically fibromyalgia. So once I like met a bunch of people in the community online who experienced that, I was like, oh, okay, this is like something that happens to other people too. Um, but yes, it definitely feels like walking on eggshells when like that is a part of your life. I can confirm. And at the same time, like I feel like both Anna and I have been able to talk about it in a way that kind of is healing. Like I know Anna also writes a lot. And like I've seen quite a bit of the way like they write about their pain and their like healing and things, and I relate to that too because I also do that as well. So I feel like a lot of people have like an outlet that they kind of have to get through the pain and just kind of express it.
such as by art.
And it's yeah, and it's wonderful that you like brought that to life in your writing because it's like adding to that and to add to specifically like a group of people in this book like of stories and everything like that's so wonderful. And like I always say, like it's amazing to see that representation out there is like something I can relate to because when you said that I was like, oh, okay, this is me. Like I didn't realize, but I was like, oh yeah, no, that's so like I don't really see that very often. Sometimes I'm represented in like chronic illness. Sometimes I'm represented in being brown. Sometimes I'm represented in like a specific chronic illness, but it was like all three. So I was like, oh wow, and like I know we're like in a similar age group and different things. So I was like, this is really cool because you brought that to life and made that possible for people like me, who will look at this book and see themselves in it and maybe even like realize and find Anna's work through you and things like that. So I think it's really remarkable what you did and how you included that. I'm really happy that Anna got to be a part of that, and it meant a lot to me personally as well.
Well, and you've been doing a lot too by talking about it.
Thank you.
So I guess what a follow up because we're talking about being vocal in a way and through art in some means. So in what way do you think or have you seen so far, like Mrinal, your book, on your art or your Instagram too, like have you seen like the impact of it or what do you anticipate the impact to be, like speaking out about, am I cutting out still
Yeah,
by the way?
I can hear
but now you're
you.
fine.
It like froze, but I could still hear you
Okay,
and me.
okay. My phone is on low battery, so I'm gonna get my charger.
Okay, no worries.
Um, but yeah. So what do you see the impact like? What has it been so far, and what do you see it being? And I'm just touching my iPhone charger.
So with book number one, obviously it's been in the world longer, and book number one brought me helped me discover a passion for public speaking in addition to everything else. And I've gotten wonderful feedback on both books alike, but since the second one is a lot newer, just published this August, I'm just now getting back into the grind of spreading awareness and marketing and putting myself out there regarding it. But I've had wonderful feedback on both books so far. With the second one, I tried harder to change up my writing style, and it's not quite as dry and clinical sounding as the first one, and people have complimented that as well. And I think that, every once in a while I'll get like a DM saying myself or maybe my kid is struggling with blah, blah, blah. Have you written a story such as that in your book, and what would be your advice going further, which is fun always to hear.
Thank you, George.
Um, yeah, no, and I think that's a really cool, like it's cool that you're getting those DMs, and I still haven't been able to read the second book to see the contrast between the clinical and the more personal style of writing, but I think both are valuable in their own ways too. So I think that's great because in one way you could have a more like clinical perspective, and the other is just more of like a personal thing. But um, on that note, though, because you were talking earlier about like finding rheumatologists and how like
Yeah.
those are like that can be really difficult finding that perfect fit, especially when a lot of them don't consider fibromyalgia in the way that they should be. So how has that impacted you in a sense, but also in what ways have you been able to, I guess, find rheumatologists? Has it been like in the online communities that you found for support? Has that been helping in terms of finding that
Yeah.
perfect fit?
Um, I definitely would say that. Wait, what was the first part of the question? I know you said about like finding it later, but did you say how do I deal with that in the beginning as well, or like how?
Yeah.
Okay, yeah, like so it was really difficult. So I guess like an update that I haven't really shared much about, like in a like really big way, but I deal with the condition EDS. Um, and I have been like trying to like get help for that for like 7 years.
Mm-hmm.
And kind of recently realized that it's kind of what everything stemmed from. Like I had a lot of like subluxations, and now I've had a lot of dislocations, and basically it got so much worse because no one was seeing it as bad enough. So that definitely has affected me. I have a lot of grief and trauma from like all that experience. But I did recently find a rheumatologist, and actually I found it through my partner who I met online in the chronic illness community. So I would say yes, I did learn from the chronic illness community, and I also have gotten like a lot of advice and like I guess even just comfort in that experience because unfortunately it's really common, like I told you. So I think like just having that community really helps too. Um, but I actually got a nerve block done on Friday for my ribs because my ribs have been coming out a lot, which yeah, it sounds as bad as it feels. So yeah, like whenever I like hiccup or sneeze or anything, they would just come out. And I was just like, this is becoming a problem because that would make my nausea really bad, and the nausea would make my ribs really bad. And it was just this vicious cycle.
Yeah.
So I finally was able to get that done. And usually you need to like redo it, like, I don't know, like once a year, kind of. So we're gonna see. It seems to be feeling okay to me. I'm just like a little bit sore, but it feels better than like when I'm moving around just for a second and it just comes out from just like turning my body.
Yeah.
So I feel like in this sense, like I've learned a lot about that because of the community and learning what's helped them and what they find comfort in for like, preventative care. I also have a physical therapist who's specifically for EDS, and that really makes a difference because physical therapy is something a lot of people don't know what to do with EDS, so they'll unintentionally actually cause more damage. So it was really important, and my physical therapist herself has it too. So like we really have like connection, and it really makes a difference to have like physicians that have the conditions as well.
Yeah.
So I feel like that has been a huge difference in my life in like the past couple years that I've started seeing people that kind of deal with it themselves, but also have just a lot of knowledge about more complex conditions and like how they're connected and things. Because the problem with a lot of people is that a lot of physicians only know one area and they don't all like know the same thing, so you have to constantly like fill them in.
Mm-hmm.
So it's helpful when doctors are aware of like several different conditions, but those doctors are always like really, really hard to get into and really busy. And so, it's like it's it's a process, and I feel like I'm finally getting to a point of getting some of this help and seeing where it goes.
Mhm.
So I do want to say there's definitely people out there for people to get help. It's just a really complicated process.
I actually have a follow-up question to that. Well, first, my husband has EDS, and also found a lot of support from a physical therapist who also had EDS. I wonder if it's the same person now, because I think you're on the East Coast, right? But I, I, I think that does a lot of wonders, and I think a lot of the times, healthcare has so many different layers to it, and there's like physical therapists, there's doctors, there's like other like practitioners as well, and the way that they play so many, like they work together in a way without really. I think that's like a problem.
Yes.
I wish there
Yeah.
was more of communication.
Actually, I learned a lot about, specifically with my physical therapist, I learned a lot about how mental health is connected to EDS. So
Yeah.
basically, when you're struggling and you're stressed, your joints actually become like looser.
Mhm. Mhm.
So a lot of my trauma and just grief and things can be linked to that
Yeah.
and vice versa. So like when my joints are looser and I'm struggling, I'll get obviously like struggles with my mental health,
Mhm.
but also struggles with my mental health will like make my joints kind of looser too. And it's really interesting because I always talk about it like, when people say their body's falling apart, like when they're stressed, like that's literally what's happening. And I was like, wow, that's like a very important piece because after I like was told that by her, she kind of like helped me figure out what's going on. Like whenever it kind of was feeling like that, I was like, oh, like what's going on in my mental health space? Like what am I feeling? Like yeah, that's been a lot. It's of course my joints are like really struggling right now, and I have kind of used things to help stabilize it. Like sometimes I have to wrap it. Sometimes I use like braces or splints for my fingers. Pretty much started having dislocations in every joint now.
Mhm.
Like 2 months ago, I had a really bad shoulder dislocation where my collarbone, shoulder, and shoulder blade were all the way forward, and I ended up in the ER because I was just like, this isn't going back, and it was happening constantly. It was just really painful. And so, there's just a lot of things that like can add to that. So I think it's really important to, like you said, that chronic illness and like mental health are connected in both ways. Mental health issues can cause chronic illness and vice versa.
Mhm.
Because I feel like there's a lot more similarities and like connections than people realize. And like a lot of people are always saying, like, oh, mental illness is so much harder because you can't see it. And then with chronic illness, it's actually so hard because you also can't see it sometimes, but it's not mentioned in the same sense because people view physical illness as in like a cast. So I like just being like, I don't have a broken bone or
Or
something,
being
like
old.
specifically pain or being old, specifically like in age and different things. So like I feel like a lot of it is just the fact that people don't know that young people can be sick in any different sense. And like the more people I meet, I feel like it's so connected to the trauma that brown people have gone through. It like definitely affects the body. I know so many people who struggle with the same conditions, and it's like the more I learn about how trauma can affect like your body, it definitely makes sense that a lot of us struggle with it, and it's so normalized that nobody knows we have it, and then also the community doesn't want us to talk about it. So it's like it's just there, and it seems like just a thing. And I feel like a lot of people have shown me that because I did not realize, but there's so many people I've met now that are like in similar communities to me, like that are brown, that are like my age, lots of different things, and have like almost a ton of the same conditions as me, and start to have like really similar stories. So it's like, I think it's really cool that you wrote that book going back to that because like the more stories that are out there, the more like people can make
Yeah.
those connections, both people that are like observing it and people living in it too.
And the more they observe that it's not a white people's disease or something,
Yeah.
and the more they realize that going to the doctor should not only be a white person's thing to do, and hopefully, you know, since we have so many Desi doctors out there, maybe some of them will start to specialize in these sorts of
Yeah,
invisible disabilities, as well as the psychiatric piece of it, and actually, you know, support each other rather than perpetuate toxic mindsets around it,
yes.
which that's a whole nother topic. I've met people that, you know, feel two ways about, you know, same race physicians and
Yes,
healthcare providers.
it can be confusing. I feel like I've had some that are good and some that are not, and you never know, but it can be really needed, I think, within specifics of like maybe if you need therapy and you want to talk to someone who kind of relates to your experience, but it's also difficult because you don't know, maybe they're going to actually invalidate you because of your community. So it's like I think people have to gauge it and go with whatever they feel comfortable with, and it's honestly not an easy decision or process, but I definitely agree that it's very two sides because people are both
Hit or
saying, you
miss.
know, yeah, like a lot of like specifically white male old doctors do not understand them. And it's like, yeah, well, none of us are white male and old a lot of the time that are there. And at the same time, sometimes talking to doctors that are older, that are like women are still like closer, and then like sometimes like women of color, you know, but I've heard like some people like younger doctors too because they're being like more aware of things and being taught a different way.
Mhm.
So it really, I think it really just goes with what you trial and error, honestly. It's horrible, but you do have to kind of bounce around through the medical system and find what works.
And I
But
think
yeah,
too, I was going to say that I think that these you know, these people of color that are going into these fields with the intent to help their community specifically should almost really need to ask themselves, they have to make sure that they don't, their biases, both subconscious and consciously, do not get in the way of their ability to treat patients too. And
yeah,
what I mean by that is, you know, when in my first book, I met a lot of people that were incredibly adamant about seeing a Desi therapist or therapist of the same religion of them. Like, you know, I want someone who understands that I don't have to waste an hour educating on how I was raised and why my family thinks and acts the way they do. I got some of that in book number 2. However, I also got some that were like, you know, I tried a Desi provider and I felt as though in a way they kind of endorsed the bad cultural norms and I got nowhere. You know, I might, from them, I might hear just pray about it more or just obey your parents more type thing. And so, and then therefore they may feel as though they're treated with less bias when they go to a non-Desi or a white provider as a result. Like, you know, they're being sympathized and empathized with, they're not sympathizing with their culture solely.
yeah,
And
Some,
now, Iman, I don't have EDS,
yeah.
but I do have hypermobility syndrome.
Ah, yes,
and
yes.
and I know they fall in a similar bucket. And I think that for years since I got the diagnosis of it, I scored about a 9 out of 10 on the Byton
Me too.
after a car crash
Oh
10 years ago.
gosh, yeah. No.
And they said that's the reason I remained bendy throughout it all.
Yup.
And then um, you know, receiving that diagnosis opened my eyes to why other people, I think, find relief from things like yoga and stretching and dance and fitness. And I do it with it. For me, it feels good in the moment, but can leave me sore the next day
Me
if
too.
not done a certain way.
Yeah.
And I think that what's hardest for me is, you know, my lack of awareness of my body in space, and the fact that an instructor may not understand those things and be able to break down everything. After years of that, I'm grateful to say that I'm with a weight trainer that has EDS familiarity, and that she's been able to kind of give me the breakdown of things like correct form and stuff while exercising, and I've been helped from it a
Oh,
bit.
that's really wonderful. I'm really happy about that. I didn't, again, I don't really process that these things exist until people tell me that they have these experiences, you know. So that's wonderful that you found this person. And I definitely relate. I've been struggling with dance specifically a lot lately because of how my joints have gotten a lot looser. And when you were saying hypermobility syndrome, like I was kind of in that category this whole entire time until it was suddenly not. But it took a while for people to catch on to that, and then at the same time to actually get help for it. So I do kind of relate to it, and I actually have danced since I was like 5. So I find that a lot of people that are in dance and do yoga and a lot of different things like that are kind of the perfect type in teachers' eyes because sometimes we're hyper. Because I've met
So it
so
helps
many
for,
people that have hypermobility like disorders that are specifically in dance, and it's really interesting because I know so
yep.
many, and it's like a very
And
common thing.
And I think they say that 1/3 of the population has hypermobility because you only need to score a 4 out of 10
Yep.
or a 3 out of 10 to be considered hypermobile, or I don't know the
Yeah.
exact number. So that's where, for me, it's not quite EDS, but a 9 out of 10 is still higher than
And
average for me.
and that's
And
still really high. Yeah,
yep.
because like for
And
me, I never had like I couldn't explain it, but in dance class, everyone would say, "Oh, you're so flexible," but really, I was just hypermobile. So when I realized something was wrong was when I could just do a back bend without really trying, or do my splits without really trying, and I was like, "Oh, this is kind of cool." And then I was like, "This shouldn't be this easy. It's never been this easy for me, like in my life, right?" And then it started becoming painful. So I was like, okay, yeah, let's not do that. So I think the thing that's most common for like a lot of people is they'll do like the party tricks, like that and
yep.
shit, like and like it's not good for you, and you don't know that, and then all of a sudden it's like, oh, okay, I shouldn't do that anymore. So I've been just like trying to work on being, like you said, aware of my body and my space, and like, because I can turn so much further than I actually should. But like being careful of my body without actually not moving at all is like a struggle that I've kind of been adjusting to. It's like, okay, be aware of my space, but also don't be scared to move at all, because
Yep.
also
The key,
not moving can make it worse too. It's
yep.
just, yep,
The key is not falling into your joints. And I think that that's where fitness instructors today are lacking the verbiage to be able to tell people that, because most average people don't do just that. And I think that sad thing is that that's kind of why I benefit from a lot of private instruction, even though it's
yeah,
more expensive.
yeah.
Now, another life changer beyond weight training has been, and Amik, I recommend, I told your cousin about this too, and she found it helpful. Jeannie Deban, a Pilates instructor who works with people with hypermobility and EDS,
Oh, that's
with
cool.
very simplistic YouTube videos that you can follow on super basic principles of movement. Like she'll break down how to lift your arm up off the ground when you're laying down, for
That's
example.
very helpful. Yeah, I mean, I do that constantly. I feel like even just moving in bed, like a lot of the time I'm in bed, I just can't do a lot. I'm very um, deconditioned by a lot of this at the moment, so I've lost a lot of strength. And so whenever I move in bed, sometimes from not getting up enough or walking around, my legs will hurt really bad. That's usually a sign when I haven't moved enough. And at the same time, I can't really turn and like flip in bed without having all those issues of like, oh, I overturned, or oh, my joint's out or something. It's really helpful to find these tips and like learn from people. And I appreciate you sharing like these resources with us. Because yeah, even if it's not like PDS specifically, there's lots of different connections with different things that can still help. Um, and I do want to say that like I know the chronic illness community is like so annoyed about yoga being like something people suggest. At the same time, Chronically Brown had really good point on like, oh, Anna's here. Um, Chronically Brown has a really good point about specifically with yoga how people, have kind of westernized it and don't teach it properly and don't respect, you know, the culture and like I guess, you know, what it really was from the start. And so people saying that in some ways is really, really offensive, you know, because it's like, yeah, that's a practice that's been helping people for a long time. No, it is not a cure, but it is actually something that can help some people. And it depends on how you use it, of course. And for me, I did like a breathing yoga class one time where basically I was just laying on the floor, focused on my breathing a lot and just doing a little bit of movement. And that was so helpful for me. They adapted a lot of it. It was specifically a studio that was kind of focused on adapting movement in yoga. So I felt like a lot of people could get like a lot of different types of help within the same class, regardless of their situation. So it was really cool because at the time I was like not able to get up very much. So they said, yeah, like just come to our yoga class where we're just on the floor and you just do a few movements and use a few like objects to help you. But that really made a difference for me. So, you know, I didn't realize how important breathing was in yoga because I feel like people talk about the movement so much. And of course, with my hypermobility, I was just like doing all of that and not really feeling good. I was just exhausted. So yeah, it's like taught me a lot. And I just wanted to say, like, I really do respect the practice, even if it's like very ridiculed in the community because it comes from something really healing too.
Yeah. I don't know, something I was thinking about long a couple of like I know these conversations um been really productive, but something like that we were talking about earlier was just finding like providers who like resemble you in a way or like have shared experiences with you. And that I've noticed is like just reflections of now just living in the Midwest for 6 or 7 months. Now you're
Yeah.
super close to me, so I think you could also maybe attest to this. But what I've seen so far, and maybe it's because I'm in a more rural area, is that there's already a shortage of like psychiatrists or like even just mental health because I can just speak more psychiatry because I've seen this in clinical setting where like patients need that referral but there's like no space to get them in and then they're clearly
Yeah.
wrong medication for like their mental illness and there's just so much there's already that shortage and then it's like finding someone who matches you in a way at least in rural Midwest is like super tough. So like, and Iman, I know you recently moved from the West and moving in general. Do you feel um, like there is that like when you move somewhere new, like finding those people that you need, is that tough to do? Or like even when not like in the Midwest, like where are you finding people that are like, you know, who resonate with you in a way?
Um, I've had like an Indian gynecologist, but never an MD that was Indian. And that was only for like a year or two, and then she left. And then I've never had an Indian therapist either. However, I have belonged to an 8-week long support group that was virtual for South Asian female identifying individuals specifically. Shout out to the Yellow Chair for Collective for doing that for me. Um, Luckily, I had the finances to be able to do it because it was a support group, so it wasn't a therapy service, therefore not insurance covered. But I do agree that in general, it is hard where I live to be able to find other Indian or South Asian individual providers or community, period. I'm not saying that there's not any where I live, but in comparison to even like whereby you live, Chicago, it's very tiny.
Mm-hmm.
Yeah.
Yeah,
I also like grew up near Chicago
right.
for like 11 years, but that was before I really noticed any of this. And at the same time, I have lots of family there that is slowly like, oh, I think I have this and I have that, and struggling in these same areas. But on the West Coast, I was there the past 11 years. I did find that there was a lot more available. I think because it's just a more diverse area in the Bay Area specifically. There's just a lot of Asian providers of all kinds. I've had a lot of like East Asian doctors, I had South Asian doctors, I've had like a lot of them, and some are like therapists, some were psychiatrists, some were like all different types of doctors. And I did find that most of the time I preferred if it was like someone younger, like I mentioned before, just because I think they just are able to understand mannerisms and things a little better sometimes, but that's of course not consistent.
Mm-hmm.
Um, and I recently got a really good cardiologist, who also is South Asian, and was like one of the most validating doctors I've ever had, and just helped me like really, really fast. Because I have POTS, and so my blood pressure was just dropping a ton all the time, and I was basically passing out constantly. Um, and my neurologist that deals with my migraine specifically just would not do anything about it. They were like, I don't think it's POTS because you're just passing out from laying down. And they're right, it was something else too, but you can't just leave me to pass out a ton. That didn't affect my
Yeah.
body very well. So I ended up like a year later seeing a doctor that just changed my blood pressure medication dosage, and I was fine. So I really appreciated
Mm-hmm.
that. And she was really like, we talked a lot about just how, yeah, a lot of people don't get this. And like, she just basically talked to me about, yeah, how the medical system can be messed up and how doctors don't get it. And it was really validating to hear that from a professional.
Mm-hmm.
And so I've had those experiences, but so my situation in the East Coast is a little complicated because I left the West Coast because I had like some family issues and it was just unplanned. And I'm currently living with my partner, but my partner has a lot of great doctors. So I've actually been really lucky in the sense that she just asks her doctors and then I get in with them. So that's actually why I've been getting a lot of help since I got here,
Mm-hmm.
more than I've gotten in all 7 years I was in the West Coast, just because she's already found doctors that are good versus me going through the process of trying to find one. So it has been a relief for me. Um, and yeah, also some of her doctors are brown too. And I think it's really hard because a lot of the time people will tell you, like specifically with my neurologist, like you should stay with this doctor because they're the only doctor in that area that deals with this. So like if anything, keep this doctor because you won't have anyone otherwise. But like that doctor was like the most traumatizing person for me. And so I had them like for 7 years, like till now, and then finally switched from them when I found that cardiologist because then they could take care of my blood pressure medication and I wouldn't have to deal with
Mm-hmm.
that. The only reason I held on to him was so I could get my blood pressure medication at that point. And so it's really hard because a lot of people don't have that choice, and a lot of people don't have the opportunity or chance to, like, I don't know, go across the country to find a doctor, go to a different country to find a doctor, because that is a reality for so many people. It is that a lot of people just can't find the physicians nearby because there's not like a ton of them that know about these things. And like I said, long wait lists, and you have to have the finances to travel. Like it's a lot of things. And also, if you're chronically ill already, you have to deal with a lot of like that together, insurance issues, all of that. There's a lot of just money involved.
And
Yeah.
I think that in general, I think I've noticed a pattern that a lot of people I meet with chronic illnesses in general say that they do not trust doctors or the healthcare systems as a whole because their illnesses are so poorly studied, so to speak, and such a puzzle for Western and Eastern medical providers alike to address. But then when you add on that additional layer of being like a person of color or coming from an otherwise marginalized community, I think that adds even more complication to it.
Yeah. Yeah. No, I know
Um,
you have to hop off soon,
oh yeah,
because you're on.
go ahead and speak for a little bit. I have to grab my partner something real quick because her blood sugar is low. So I'm just gonna hop off for a second, like I'm just gonna disappear. So you go ahead. I'll be right back.
No worries. Um, yeah, I hope Hope everything's okay. Yeah, Mrinal, do you have any closing thoughts before you hop off? I thought a lot of your insights were just so amazing. Like, yeah.
That is about all. I think that, and then also, were we saying something earlier about how December was Disability Awareness Month?
No, we forgot to say it. So, yes, that was also a main motivation to have this live in December. Yeah.
Yeah. And then also, I'll say too that, the concept of disability and what it means, and, both literally and otherwise, is a whole nother layer to navigate in our
Mhm.
community.
Yeah. No, definitely. It definitely is. And I think there's so many amazing resources out there that's like specifically focused on that intersection. Like Iman's page is a huge example of that. There's Chronically Brown, and there's Anna's story in your book as well as her page. And I think those voices have been a huge pillar of support for many. And I think there's so many people who've joined this live specific to just like 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 for these types of platforms like it's just really helpful to have that support and like talking about that. um yeah. Are there any other thoughts about this, I guess, before you hop off?
Um, I would encourage you all in the meantime for Awareness Month I, to educate yourselves on what a dynamic disability
Mhm.
is.
Mhm.
I think that that's a term that's important because it forces people to challenge how the stereotypical view of that term
Yeah.
is seen as, and what it needs to be expanded to, regardless to whether or not you like the word disability or not. So, which, that's a whole nother debate that, some people are fine with it. Some people say, I like terms like differently abled better, but then there's people that hate that term too
Yeah.
for various reasons.
Personal preference for like everyone. I feel like you have to respect the person and their experience, but it's also helpful to like ask. I think sometimes what the person prefers. But if you say disabled, most of the time, like people will correct you if they want to. But if you say like differently abled, a lot more people will get offended. I think a lot of the time.
Mhm.
But I do, yeah, relate a lot to dynamic disability as that is like one of the first things that led me to realizing I was disabled. I started off with that and was like, oh yeah, like I'm definitely disabled, like sometimes because a lot of the time I have times where I can do something and then suddenly I can't and it's back and forth. So it's dynamic. And that
Yeah.
was a really helpful term to kind of find, I guess, that connection and like begin that journey. So I would definitely recommend that as well.
Right. And let me say too that everyone has strengths, everyone has weaknesses, things they can do, things they can't do, things they can sometimes do. And I think that, if the reason that disability has such an ugly connotation to it for some is that they confuse it with an inability. But, what struck me
Yeah,
was one day I read something like, what if having, what if being born with one arm was the norm and the rest of us were considered disabled? How would society be structured? How would accessibility be structured? Education, jobs.
yeah,
Wow.
that's a really good point. I feel like a lot of people don't realize how much the disabled community goes through with accessibility and like accommodations and things because they don't have to think about it. But it's also so much more complex than they think because there's so many different types. So if you were to think about people with like one arm having being the norm, then everything else would be like there'd be so many different versions of what wouldn't be, and you'd have to adapt to all those things. But
So
people
they're
usually, yeah,
disabled in the spaces where they cannot thrive with one arm.
yeah. And so it's like, I think a lot of people can't put that together until they experience it themselves or read it, like you said, in that way. But yeah, I think a big part of it is definitely the internalized ableism we all have that's just ingrained in us from everything and just society as a whole that like makes it hard to connect to the word disabled at all. because we've been taught, like, even if we don't know why, we're just taught that that isn't a good thing. It's like connected to sickness, it's connected to like age, like getting old, you know,
Incompetent.
all these different things. Yeah, and that's not true. And I think that's why it's important to, like, you know, form your opinions through learning from the disabled people themselves and seeing how they view themselves, because a lot of people don't view themselves that way.
And I think too, in our community, it's important to teach. I think what's more important is to get rid of this idea of enmeshment when it comes to our elders and stuff. And I really wish that elders would stop making it about them every time that, you know, one of their kids comes out saying that they struggle with, you know, a mental health challenge or a disability or anything else. Like, what did I do to deserve a child like this? And, you know,
Yeah,
you're
or
not
I
doing,
deal with this too.
who
I
will
do this too.
marry you,
You're
who will marry your
fine.
siblings. And
Yeah, it's complicated for sure. I think there's a lot of education that is just lacking, and specifically in South Asia as well. I know there's a lot less there, so people are just not getting that help and not learning and being. I feel like a lot of people aren't treated properly that are disabled in like India and those areas. There are some great doctors, of course, also, but I think it goes with what you can have access to. So it's really important. Like, I know a lot of people are trying to, you know, educate in different languages, because there's not a lot of language that is there for disability in lots of different languages, or people will find it to be like very offensive, which is again like kind of part of why I think a lot of people view it that way. Like, I think I was asking my friend what it was in Spanish, and it was like something like um basically like the capacity, like it, you don't have the capacity to do something. So like you said, it's more connected to inability than specifically disability. So I feel like there's so many reasons why people struggle with that, and a lot of it is in the fact that there's no language for it too.
Wow. Yeah, I think that language thing is just like I think of that in the context of even just health in general, and like the way certain things are described in different cultures or languages tells you a lot about the thought process, or like what you think about, like the stigmas really come to show based off of how you're describing something, like even mental health in South Asian languages. Like, do we have a lot of terms to describe them? I personally don't know that
Yeah, I
many.
don't
Yeah.
there's
know either.
a lot of conditions that don't have a word for it in the South Asian languages. Now, whether they have the pills and stuff to treat the symptoms, I'm not so sure, but it definitely doesn't make it easier to you know, people, the non-medical professionals around you, the magnitude of what someone may be going through,
Yeah,
to the point where, you know, someone may equate a concussion to a headache.
you
Mhm.
don't have language for it. You can't tell them what you're feeling too. So it's like both they can't understand it, and you also don't know how to explain what's going on.
Yeah.
I feel like that's one of the biggest things that I dealt with before I learned everything and like how to use medical terms,
Yeah.
because doctors would just be like, "Oh, okay, so it's like it's I don't know, on a scale of 1 to 10, right?" And I was like, "Oh, it's like a 3." And later, some doctor told me like, "No, no, no, you weren't able to move. That's like a 10." I was like, "Oh, I thought 10 was like you're about to like die." And they're like, "Oh no, that's not what a 10 is." But everyone has a different idea of
Yeah.
what a 10 is. So the pain scale is just so hard to like follow.
I
So you
Speaking of
don't have the
which,
language and stuff, you know?
I do want to say, I think, Iman, you brought this point up earlier, that medical education is changing, and like when we're told to ask that question, like what does it feel from 1 to 10, you have to describe like what 10,
I
like
always
what.
ask now because I just don't know what the doctors
Yeah.
ask.
But also like from like I know something for me is like we have classes on community health and like just disparities, and like that stuff, medical humanities, we have courses on that, like that stuff that we have now that doctors from before didn't. Some might have had it, but a lot of them didn't have
Yeah.
that education. So I think medical education is changing in a way that like I hope will be better for the future. At least I can speak for people. um, so Yeah, I do have hope, and I think these conversations are, you know, helping those providers in the future to have like better perspective on things, but also empowering, some people like can live with certain chronic conditions and not even know for years. Like, and I think that talking more about them helps people recognize certain symptoms, identify with them, and like, you know, get that support that they need to. So, yeah, thank you both for the work that both of you do. I think it's really important stuff, and yeah. So it's like raining. I don't know if you can hear it.
So before I hop off, I just wanted to say too that so number one, when it comes to things like pain and the fact that you may not be able to pick up on these things or emotions, I'm no professional, but I'm starting to explore a thing called interoception. It's the eighth sense. So when you think about senses, you think sight, hearing, touch, taste, and feel. However, there's also vestibular, which is balance, proprioception, which is awareness of body and space, and interoception, which is your ability to pick up on your internalized cues and respond to them accordingly.
Mm.
There's
That's
resources out there
really helpful.
on it.
Yeah. As someone who has vestibular migraine, like I definitely have become more aware of my vestibular sense of just like having balance issues and motion sickness and things, and that makes a lot of sense to me.
And then the interoception is the one that helps you pick up on things such as hunger, thirst, sexual
Yeah,
arousal, emotions, toileting needs,
yeah,
and even in a case like this, pain. You figure out what you're feeling, where in your body is feeling it, put a label on it, and then decide what am I going to do with this, and identify signals that are small versus big.
yeah. Oh wow, that's
For
really
those who
helpful.
can't do so for those who may not do occupational therapy for these things, there's resources available on the internet as a starting point, such as YouTube, such as I'm a big fan of Kelly Mahler. Kelly, Mahler. She has workbooks on it, as well as a Facebook group, as well as free printable resources on her website.
That's awesome.
That's amazing. Thank you for sharing that.
Yep. And then also, before I hop off, again, the name of my book is Taboo, South Asian Mental Health Stories. And you can read a sample of it, purchase it, either or both. The link is in my bio for US residents, but it's also on Amazon and other countries too.
Yes, definitely support the book,
Yeah.
and definitely post you on the Brown Women Health page after this.
All
Okay.
right. Nice to
Can I
talk
hop
to
off? You
you.
guys can continue if you want.
All right, sounds good.
Okay.
Thanks, Mrinal.
Bye.
Okay, and then is this a good time to transition to the I
The other topic?
yes.
Yes. I'm sure I'm happy to do that.
Okay,
I have been.
so um something that I thought was really important to cover as well is just the mental health portion, especially, but general about what's happening right now in Palestine and Israel. So, um, Iman, do you want to talk a little bit about how that might have impacted you, especially in the realms of this conversation, but just in general too?
Yeah. So I guess for me personally, there's several things tied to it, right? So I feel like with being Muslim, I've been hearing about this like issue since I was young. I was like playing a song when I was little that was saying Palestine will be free, and every time I hear that song now, I'm like, oh my gosh, like we're still here. Like I always wondered, would I ever see Palestine free in my lifetime? And it's so much grief, and at the same time, like I'm glad that people are finally hearing and like paying attention.
Mhm.
Because a lot of people are, and there's like a lot of connection because for me in high school in the Bay Area, I knew some Palestinian Muslims that were hijabis that I was friends with, and they would have protests for Palestine, like even in like 2014. So I feel like I learned a lot about the issue through them, and I'm really grateful for that.
Mhm.
And so I guess when, everything happened and continues to happen, I've just been really feeling a lot of emotions. And I've also connected with a lot of queer Muslims through my journey, and a lot of them happen to be queer Arabs or queer Palestinians. And so I feel like I have like a closeness to that now too, just knowing the stories and seeing that grief up close. And I also made a friend online who is right now in South Lebanon. So I am really checking on her all the time to, like, see what's going on because she's right in the middle of everything.
Mhm.
So I feel like I don't know if I can talk about like what's going on just because I probably I don't think I'm the best person for that, but I
Mhm.
have lots of people that I can recommend to, keep up with it. And I wanted to say, um, it's, I feel like every part of me is connected to this issue in the sense that disability is like treated as eugenics. And so a lot of people don't realize that genocide in itself is like caused by people, causing an outbreak of illness or, leaving people sick and not able to take care of themselves. They, and that trauma is there for like years and generations past. Like I said, trauma, it just continues. So it's like even if people are away from Gaza now and they are getting help, it still will live on through them because trauma doesn't just go away like that, and it affects the body, it affects the mind. And so, I guess thinking about all the people who, are left disabled and are getting illnesses and are dying, like all of that together, it feels very close to like me feeling sick all the time. And remembering that everything I have access to, a lot of people in this situation don't.
Yeah.
And if I was there, I wouldn't it wouldn't be possible for me to function. Or like my partner says, like he has to have insulin, like there's an insulin shortage there, and he wouldn't survive if there was no insulin. So like it's a very real thing to kind of, I think about those things. And a lot of people will say, oh, that's so sad, and like just feel better about it because you're not there. But it's like, no, I think we owe it to people to talk about these things and think about these things. It's the least we can do from over here. Have those conversations, lift people's voices, um, both over there and all over the world. Really appreciate the culture, really fight, I guess, the pink washing specifically. There are queer Palestinians, there are queer Muslims, there are lots of people that are speaking about it that I'm friends with now. And so I feel like seeing their pain in the sense of Muslims being homophobic and the queer community being Islamophobic, it's just a really complicated thing. And I've also experienced some falling outs with the chronic illness community, with people being, really just horrible about the issues and really um, cruel.
Mhm.
And, deciding for myself that, like, yeah, I don't want to be, friends with this person because I think this is not something I can just support. Like being nice to everyone doesn't include letting people hurt other people.
Yeah.
And I think that like one of the things that happened to me was someone like reached out and said, "Hey, like I know you're on the Palestine side of things, but like I want to make sure, like I want to actually try to see if we can like work things out and be friends. If not, like that's cool, but I hope, that's fine." And it was kind of like I just didn't know, I didn't know what to do with that because I was like, why are you reaching out to me? Why are you like telling me proudly that you're a Zionist? Because they told me that. They're like, yeah, I just wanted to let you know I am a Zionist. And I was like, to tell me that, knowing I'm a queer Muslim who is just like very like connected to this, like it almost felt like they were doing it for them. They were not taking account of anything that they were like I would be feeling. And it was also like right after the ceasefire ended, so I was like, this is just horrible timing, or not ceasefire, but like the little break they had, which wasn't a break. You know, so I feel like it's difficult seeing that in the community too, because you know there's going to be people in every single community that's going to be on different sides of things. And I think the things that have been helping me is to really connect with the communities who are supportive, you know, hold each other together, lift up the people that are, you know, hurting the most and like going through this, you know, and the people close to me who are really, their whole life is this like, you know, reality. And it's a lot of grief. It's definitely a lot of grief, and sometimes I'm like, okay, I have to like take a step back sometimes, you know, make sure that I'm taking care of myself.
Mm-hmm.
But at the same time, we can't afford to just take a break and not care, because people are dying, people are fighting, and there's way too much that people are ignoring. And I feel like it's so easy to connect to that, being that a lot of who I am is ignored. You know, being disabled, people don't care about the fact that COVID exists, and you know, they're not really trying to protect themselves with chronic, like the virus anymore, because it's just been told that, you know, it's fine. And at the same time, lots of people that are chronically ill are getting sick, and like can also, people that are well are getting sick, and just it's turning into chronic illnesses. And the world is not prepared for how many people are going to be ill, because like you said, there's already a shortage of everything and people are already not getting help. So I feel like it's really hard to both see it in like the really up close in my own life perspective, but also to see the parallels that I'm seeing in other people's lives and in Palestine, with how people are reacting to seeing basically a live stream of these things, you know. And I I think what a lot of it comes down to for me is, you know, learning about the culture, learning about the joy, finding out about the people, knowing the people's names, knowing, like, learning about who they are, learning about the history, you know, really making sure we keep the memories alive, and, you know, connecting to people that are still here, that have that culture, and just like really celebrating them. Because I think that, you know, the way people view, I guess, just Arabs in general is very terrible. And just there's a lot of problems with how people are faced with um just violence all the time for just existing, you know. And it's it's a privilege to be able to just exist without having, I guess, people assume you are a part of something, you know. And I think a lot of people don't think about that. And there's a lot of different reasons that I feel like I connect to that. Like being brown, like people can assume any type of brown is a certain type of brown, and it doesn't matter if they are or not. They're still going to be, you know, attacked in that way, you know. And if you are, I guess, visibly Muslim, then you're also going to have issues, right? And if you're visually disabled in the sense that you have like a cane or a wheelchair, people are gonna assume you're weak and just an easier target, right? So like I feel like a lot of people think that it's horrible to think about all the issues that there can be, but how can we make a difference if we're just ignoring it and just, you know, saying, hey, that's not our experience, we just don't know better, and not trying to learn from other people and their experiences. I feel like me being someone who has intersectional identities, and knowing people with intersectional identities, both similar to mine and different, really opens my eyes to what's going on and what people go through. Because we're never going to fully understand everyone's experiences and lives, as we just don't have, we just won't see it the same being who we are, you know? And we can try our best, but we never will fully understand. Like I always say, like, I understand. And then I'm like, well, you know, I can imagine, but I guess I can't understand because sometimes you literally just aren't going to have that experience, you know? And so I feel like the thing that I've been doing a lot of the time during all of this is reconnecting with some of the parts of joy and culture and in Palestinians that I kind of connect with. So I used to go to Islamic school and I used to learn Arabic. And I've been hearing so much Arabic and talking to a lot of people that are Arab that I'm friends with and queer Arabs and just like wanting so badly to reconnect with the language because I always found it really beautiful. And you know, I've been doing that. I've been spending time reconnecting with the language and reconnecting with people who have connection to the language and things like that. And I feel like that's been really healing for me. I just really enjoy having that connection. Um, and I feel like, you know, it's one of the ways I can understand, maybe like try to understand what they're saying. And I know a lot of people are speaking in English, but I also just want to understand more and like see through their experiences, you know, because I, like we talked about, language is not the same when it's translated. And so I really just want to be able to understand more people and to see, like, knowing the days of the week in Arabic and to see how, like, they were just like saying something was bad and it was a calendar. I'm just like, I know Arabic, so I know this is just the days of the week and it's on a calendar, but like the amount of people that were convinced it wasn't that, and they were also reading it from left to right, which is not how you read Arabic, right? So like knowing some of those things you could see through a lot of like the propaganda. And I feel like for me, I came across something really cool today actually. I came across an ASL interpreter that made a video about different signs involving like all of what's talked about with Palestine right now. And it was really cool because their whole account is currently just like them interpreting different people's videos so people can understand it. Because, you know, the problem with a lot of people and advocacy is that a lot of what people share is not accessible, so they can't fully help. So it's really wonderful when people try other ways to do that. And I've seen lots of different versions of that. And for me, I just try to, you know, share those, make sure people know that are both disabled and not, kind of know my audience of the different communities I'm from and share both resources that are connected to theirs and and resources that have helped me, but also just, you know, make sure that I'm talking about these things because a lot of people won't come across those, you know, I guess niche topics because a lot of people won't see disability represented because like a lot of people are talking about how, you know, advocating online is just as important as anything else. And that's a conversation the disability community has been having for a long time. Like we've made a lot of change from just being on the internet and, you know, really speaking up. So, you know, in that sense, people are very ableist, and it was really cool to see a lot of people, you know, realize that, and listen to us and really, I guess, grow from that and also feel less guilty if they can't go out, you know, if they don't have the privilege of, I guess, being out there safely, or, you know, a lot of people aren't masked. So if they're not safe to be out because they could get sick and they're more immunocompromised, you know, and then there's also just people's jobs out on the line. Not everyone can afford to talk about it publicly, you know, so there's a lot of different things. And I think for me, I just try to do the little things I can and help, like, just educate myself as I'm able. I have a lot of issues with focus, I have a lot of issues with being overstimulated from information. So sometimes I will take breaks and that's okay, but when I do feel like I can, I try to in whatever ways. And sometimes that's just educating people, sometimes that's just sharing resources because that still is something. That's still, getting the word out there, getting people to acknowledge it. And I am really shadow banned at the moment because of it. I got like 100 views like recently, and then it was like dropping to like 20, and usually I get like 600 plus on my stories. So I was just like, yeah, okay, it's because I'm talking about this. So the censorship that's been going on is really making it hard to advocate, but a lot of people are finding ways, and accounts are being taken down and all these things, but people are still just going and talking, and that nothing's going to stop them because this isn't okay. And it's been wonderful to see the solidarity between so many people, so many places all over the world, just like all of that solidarity in community. And at the same time, just looking at like, why do we always take this long to notice? Why do people have to be literally dying and screaming because they're about to like be gone for us to care? And I feel like I just spent a lot of time crying because it's just so hard to, think about that. And being someone who is Bangladeshi, my mom was actually born the year that Bangladesh became independent, and I remember when I was little, she told me like, yeah, if I had cried as a baby, I might not be here today, and you might not be here today. And I was just like, oh, what do I do with that? Right? So, like, I guess having that really real feeling and realizing that so many people's reality right now in lots of different places around the world and continues to be the reality for so many people, it's so important to speak about it. It's so important to share. And, like I said, like, people are always going to try to, cut off the language, cut off the culture, just like, really make people not able to express themselves and, live their lives as they are, like in their origins. And so like, I know that for Bangladesh, like, Bangla was practically like banned, like you couldn't speak it, and we had to like fight for that right. And I see that, Arabic is being treated like the same way over there. And it's a very common pattern, I feel like, for people to do that when they're an oppressor, to get control. Because if you control language, then you control communication. And with like the culture and everything, like if you don't know the beauty of something, it's
Mhm.
like you don't know anything. And so I feel like it's just so important to learn and like admire just the beauty and the like richness in the culture and just the beautiful parts of these people. And even just the fact that, forget all of that, they deserve to live even if they weren't such beautiful people, such kind people, even if they weren't just moms and children, like they're people, the human thing is to care. So I feel like for me, I'm just processing all of this, and you know like I said, multiple different things, but I can hold all those things, at the same time, and still, process, let myself grieve, then sometimes pass out because I'm so exhausted from feeling emotions because my body can't do it. My body's been struggling a little bit because of all the grief, but I am taking care of myself the best I can, advocating when I'm able to, um, and trying to just, keep, I guess, educated on whatever's going on as I can.
Mhm.
And like, I don't know, finding communities has been really helpful for me right now, and forming them. So recently I made like a specifically South Asian and queer chat, um, and asked a lot of people, who would want to join, and it was so many people. And my friend came up with this idea and asked me because she's like, I think you know a lot of people like all over the world, so I want it to be like a very diverse experience. And it's amazing. It's been really helpful during this time, and I also was asked to make a queer Muslim group chat. So I did that like a couple days ago or something like that. And that's been a really beautiful space too. And then one of my friends decided to make a queer Arab group chat, and so I helped boost that. And then they were like, I want to include you in this as like an ally. So it was really cool to, I guess, have that connection, having these communities, finding these ways to connect and having people to talk to during this time, you know, grieving together, talking about the frustrations, the joys, everything, and having a place to do that. It's so important. There's so many people that are hosting like virtual events to like read, books by Palestinian authors, or, to talk to Palestinian people about what's going on. There's lots of different things that I've gotten to be a part of because they're online, and it's been really wonderful to see that. Um, because a lot of things are in person, and a lot of people can't do that for multiple reasons.
Mhm.
So, seeing people talk about how to advocate in a safe way, online, in person, being really careful at protests, making sure that you're like concealing your identity, making sure you're not exposing anyone else's identity online, really feel like a lot of people are having to look at all of that. And there's a lot of people that are online and that just use, social media so, I guess, without thinking, that are just having to kind of take a step back and look at what they're really doing and what the impact is having on people. And I think this has been a problem forever, right? But it's because it's going on so much to, I think, a lot of privileged people in a different area that it's becoming a bigger thing to acknowledge.
Yeah.
And I feel like it's really hard, being someone who is chronically ill and disabled. I do have to go out. I can't just stay home when people are having like a full strike. Sometimes I have to go to a doctor's appointment. Sometimes I have to, I don't know, I have to just I go to a hospital or something, and it's like you do what you can. Not everyone can do things the same way, and as long as you're trying, like I think that's really important. And not to let it flip, not to, become numb to it, because it's really easy to do that too.
Mhm.
To just become used to how horrible it is and just be like, oh, like, yeah, this is just how it is. This is just how life is now. To really check in and remind yourself that this is not normal. And to, I guess, remind yourself to feel how horrible it is.
Mhm.
And also at the same time, I guess I just keep reminding people like it's normal to not feel like you can keep going when things are like so bad. Like to feel like you can't do finals, to feel like you can't, finish your homework, like different things like that. To feel like you're at your job and you're just thinking about this instead of what you're like supposed to be doing. Like that's normal because this is not a normal situation.
Mhm.
And so a lot of the guilt, I think guilt is a big part. Like guilt about not being able to do much, guilt about maybe not being able to do the things that people are asking, guilt
Mhm.
about the fact that you always wish you could be doing more, And I think a lot of what disability has taught me is that those guilts only make it harder and make you feel heavier about things. So just learning to alleviate those guilts and learning to be kind to yourself. um, for me, sometimes that's just like taking some time to color, taking some time to just take a nap, really making sure that I spend time just doing things to rejuvenate myself. And I think a lot of the time with being sick, self care is not medically related. So I don't tend to, do a lot of things that a lot of people do for self care. Like I won't like take a bath because taking baths are like something that are really hard for me.
Yeah.
Like I mentioned earlier. And so, maybe self care is more like, making sure that I spend some time making sure like I really pay attention to what I enjoy, make some time for the things I enjoy, make some time to talk to people, make some time to, in whatever way I can, maybe even just sometimes it's just like letting myself rest and really just relaxing,
Yeah.
like making sure that I'm not holding so much stress in my body, right? Um, and I think the reality is that, like I said, it's really heavy, it's really hard, and there's not going to be this easy solution of just, making it feel better because a lot of therapists specifically, like, they don't really know how to handle this. They're not really, I feel like a lot of people have been disappointed by therapists. And I feel like it's because therapy, it it doesn't really work when there's all these issues. You can't just self-care yourself out of things like this.
Mm-hmm.
um and the reality is we need something else, and so it's hard to sit with that reality. And I feel like just being disabled, I've sat with that reality for a while and seen it, and so it's somewhat easier for me to grasp that than people, I guess, kind of feeling that now. And at the same time, it's hurting me because I remember what it felt like when I felt that too in the beginning. And so I guess trying to use my platform and use my voice and use my experiences to help people through that, because I didn't really have that when I went through it, and also to remember kind of what that felt like for me and kind of like, I guess, empathize, um and at the same time just knowing that not everyone's going to understand everything, and we can't expect everyone to jump in and just be completely in it, but also we have to listen to the people that have been talking about this forever, talk about the people that have been protesting forever, talk about the people who are Palestinian who've been fighting and just like really screaming about this since they were young, and like just knowing everything, being connected to it, having family there, all of that. And so we can't just like expect that we can jump in and just take control, because one, that's not our place, and two, I think that whenever people do that, it's like you kind of disrupt the actual intention, and it gets to be like you think you can do it better than them, because being an ally is tough, and one of the things you have to do when you're an ally is really step out of it being about you.
Mm-hmm.
And at the same time, like I said, it's really helpful to know your audience. It's helpful to know your connections to things, and people are saying to use that, make sure people connect with it. Because unfortunately, sometimes you have to get people to care by making it about them, but you got to make sure that you still make the message about the other thing.
Yeah.
And it takes a lot of brain power. It takes a lot of listening. It takes a lot of stepping back and just being uncomfortable with how much you don't know, being uncomfortable with how much you let happen, in a sense, being uncomfortable knowing that being in America, our government is supporting this, and like we can't really change that. We're just, a part of it, and being horrified. And it's like a lot of that, a lot of that is something that's too much to ask of people. I think they think so. It's the least they can do, but I think it's really something that people are not taught to. Like, people will say, yes, be there for them. But I think to truly understand an experience different than yourself, you have to be uncomfortable. You have to be comfortable with the discomfort of being uncomfortable with someone's experiences that you don't relate to, instead of being like, oh, this is uncomfortable, so I'm just going to go. This is uncomfortable, so let me just not look. And so it's hard because the more privileged you are, the easier it is to ignore, because you're not very connected to it. And I feel like there's so many layers to that, with like solidarity and with community, because it's difficult to keep yourself on that line of making sure that you're holding yourself accountable. And that's why I always tell people that, no, hold me accountable too, like, yeah, I can say something one day, but like we always need to fact check and like make sure everyone is like, still on that place, like, because we can all change at one point. Because like one thing I like to say is no one is really just not able to be, I guess, convinced by propaganda. Like anyone can kind of fall into that, and you know that reality is hard, but it's I think a very big part of that denial is how people don't think that they're going through that. And so sometimes listening to the people that are more, I guess, good with media literacy and things like that, really taking time to learn that even what you like consume, what you're learning from, it's important to know like where those people are getting information.
Yeah.
With like boycotting and things, seeing how much that's affecting companies to the fact that they're trying to offer free stuff and lowering prices, and seeing that they're really just trying to get anything to get people to go and support them. And so I definitely feel like there's a lot of things that people can do and can't do, like I said, and it's really about thinking about all these things together and really trying to process and come up with what you can do, what you feel like you want to support. I think from even just having like knowing I was going to have this conversation, and I just I'm kind of making a list now, and I think I'm gonna probably make a post with different resources of some kind, and then also probably put it on a document in like my bio or something that has like a lot of different things, because from kind of planning this, I realized that the different things I could think about is, ways that I support my mental health specifically, and then the parts of communities that I'm a part of and what people, I guess, resources that can be connected to this issue for them, and then also making sure that we have like voices on the ground in Palestine boosted, making sure that people know what those are. There's some telegrams that I'm a part of that are constantly having updates that are like more secure than any other social media, where they're updating what's happening. Like I got several during this live, and seeing all of that, and really, I asked a bunch of people before this actually, specifically what some of them wanted who are part of this community. And so I wanted to share some of that. So these are some tips from Palestinian voices and like intersectional communities, like some Arabs that are like close to it, some people that are mixed and have like are part Palestinian, little things like that. So I asked them directly, and so some people said posting about protest dates and pressuring people in power to call for a ceasefire is really important. That's like one of the top things you can do. And that it's also important when people repost Palestinian content, which can include people directly in Palestine at the moment, or posting about what's happening and people in other places in the world talking about how it affects them who are a part of this community. Sharing Palestinian content about our history and culture is pretty important too, because it not only makes it harder for others to erase, but also educates people, right? So we're fighting that erasure. And some of the tips that they've said they've specifically had during this time, that it's difficult dealing with mental health during it all, but that's why it's important to surround yourself with people you can talk to about it, and to try to stay hopeful, because once you lose that hope, it becomes a spiral. And going through that process and having other people that get that and holding each other together. And I was really glad that that was what they shared with me. And I also asked some people just in general what some of them like get help with, and I'm just trying to find that real quick. But I think that it's really important to talk to other people and, use the community and use the like whole group of people to share resources and us do what we're good at, us do what we're focused on, and, we can share the work basically, and I think that's a really important thing to do because like you can get overwhelmed and try to do everything, but the reality is that that's not sustainable and that's not possible for like multiple reasons, right? So there are people protesting like on the ground. There are people, calling people all the time. There are people, hosting events. There are people holding space for grief. There are people talking about it with their friends. There are people boycotting, there's people that are doing a mix of these things. And like I have some queer Palestinian friends who are making like update videos on TikTok who are like summing up like each day of everything that's happened specifically within um dogs just got called up specifically within like the people that are sending in these updates that I just spoke about on the telegrams, like really taking those notes, making sure that they're concise and then saying it all. And they have like a whole like playlist on TikTok for like all their updates, and I really feel like that's a really good way to boost. So I try to repost those and send those to people, also watch them myself, kind of know what's going on.
Yeah.
And there's like so many different things that we can do, but I feel like one of the most important is to just never let this become normal and never let it just become something we ignore,
Yeah.
making sure that we really stay aware, stay awake. We can take breaks and we can take shifts, I guess. Like, some people will be resting, some people will be, going, and then we switch. So there's never someone that's really there's never everyone just down, And like I said, disabilities taught me a lot about that too, with community care, with mutual aid. Like, there's so many things that disability has taught me to make advocating, I guess, accessible and also more sustainable. And maybe sometimes that's what I can share with the world to make it so that more people can, do that in the sense of anything really. And I feel like it's helpful just in life, right? So there's a lot. Like I said, I said a lot, but I definitely have been thinking about it a lot, and I really am glad that we touched on this because I think it's really important. And I've been trying to find a way to, I guess, share more. And I've just been really drained. So this is a very accessible way for me, I think, to talk with someone. And I want to continue doing that, talking with people and listening to people, because sometimes writing with my brain, it just doesn't really come together. And, we can do whatever is possible for us at the moment, and it can change, like we were talking about with dynamic disability. Like sometimes I can write, and right now it's just really complicated and just feels like I'm not able to put it into words. But sometimes when I speak it, it's like it makes sense somehow, and sometimes I try to speak into things and like write it out, but then I get kind of lost. So, just finding what that outlet is for you. And like, there are podcasts, there are people's writings, there are lots of different versions of taking in this information as well, and like I said, making the, I guess, movement accessible is really important to include more people, making sure that there's different versions of things so people can take in the information, maybe if you have a video explaining what the video says with like image descriptions, or video descriptions, and I personally get really drained from doing that. And I sometimes feel guilty because, with disability, you sometimes you can't do the things that are going to help you actually. but it's even more important for the people that can. And so many people that can are not doing that work, because they don't know about it and it's not talked about or, become important enough.
Mm-hmm.
So I think something that's really important that's happened on TikTok is that people just started using captions,
Yeah.
just because it became a trend. But it
Mm-hmm.
actually became very helpful for me
Yeah.
because with processing information, sometimes I just can't listen to it.
Mm-hmm.
Sometimes I just need to read it. I can't understand what they're saying, whatever. And I've noticed some things are even translating from different languages in captions. So, those things make it so much more accessible. And if we could do that, even when it's not trendy, because it's just accessible, and accessibility really just helps
Mm-hmm.
people, it cannot really just make it worse for people. It's going to benefit people.
Yeah.
So I
I
think there's a
do
lot to
have
think
to hop
about
off
there.
in a few minutes.
Yeah,
So,
yeah, yeah.
is there any closing thoughts that you have about this live? I don't want to cut you off or anything.
No, all good. I was gonna say same here, but basically, I think my closing thoughts are just to, keep fighting, keep talking about it, keep, being aware of it, and just I guess, make space and time for people that are going through this and really learn from them, listen to them,
Mhm.
never, stop listening to them, and keep their culture alive, keep their memory alive, even though they are alive, just make it more, I guess, so that more people know about it, share about it, just keep it going.
Yeah.
And I think in whatever ways that's possible. Um,
Yeah.
but yeah, I just realized I talked forever and
No,
I
it was
don't know.
very, you like what you said was like packed with a lot of especially actionable insights. And I do want to say just to reiterate, definitely go check out your bio and join those chats. I think I recently joined that and I saw so much that's really important. So thank you so much for sharing all of this. And
Yeah,
yeah, I'm sorry I have to hop off, but I
no worries.
that
I actually should get going
yeah, I'm
too, and
sure.
I appreciate you so much for having me, and
No,
especially for making space for this specific
no,
issue
I
because
appreciate
I
you
wanted to speak
for
about it.
no, because especially I feel like you really well researched out what to say today and get those voices included, Palestinian voices included in this, and I think that's really important too. And I also wanted to I wanted to say this at the very beginning, but your stories, Instagram stories, have some you've written things this is what you have, and you mentioned this too, this is what you have and this is what people right now in Palestine don't have. And I think those that puts a lot of things into perspective, and I really appreciate the ways you've been raising awareness, and
Thank
I
you.
hope to be able to also circulate some of those same resources. So
Yeah,
thank you.
I can totally send you some things that I talked about, and I probably will post some on my
Mhm.
story and, make sure that people kind of see what we talked about here.
Yeah, great.
So still putting those resources together, but as I do it, I will make sure I send it to you and everything.
Thank you. All right.
Yeah,
Well, have a great rest of your day, and thanks so much
you
for being
too.
live.
Thank you
All right.
again. Take care.
You too.
Bye.
Bye.